Knock, knock.
Come in.
Hi, Major Ann. I'll be your nursing student today. Can you please tell me your name and date of birth?
Casey Sisk, 072407.
Okay, and we're going to be doing a thorax and chest assessment on you, if that's okay.
Okay.
Alright, I'm going to wash my hands. First, I'm going to inspect the interior chest, looking at the skin color, making sure that the interior chest is symmetrical, and I'm going to be noting the patient's respirations, as well as her posture, her position, and facial expressions. Alright, and now I'm going to palpate the interior chest. First, I'm going to palpate to detect any tactile fremitus. So I'm going to have you say the number 99.
99.
Again,
99.
one more time.
99.
Okay. And I'm going to palpate the interior chest for any lumps or masses. Okay. I'm going to have you turn around, and I'm going to check the lung expansion. So I'm going to have you breathe in and out. Okay, one more time. Okay, good. Alright, and now I'm going to palpate the posterior chest to detect any tactile fremitus. So I'm going to have you say the number 99.
99.
Again,
99.
again,
99.
one more time.
99.
Okay, and now I'm going to percuss the posterior chest. If you feel any pain at any moment, just let me know and we'll stop the assessment.
Okay.
Okay. And now I'm going to also take the posterior chest. So first I'm just going to have you breathe in and out, take some deep breaths through your mouth. Every time that you feel my stethoscope touch your skin. Alright, and I'm going to touch in the same places. I'm going to have you say the number 99 every time that you feel my stethoscope touch your skin.
99. 99. 99. 99. 99. 99. 99. 99.
Alright, I'm going to do the same thing, and I'm going to have you just say the letter E, but hold it out like E.
Okay. E. 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 E.
Alright, and the last thing I'm going to do is I'm going to touch in the same places. I'm going to have you whisper the number 99 every time that you feel my stethoscope touch your skin. 99. Okay. Alright, and everything looks good there. So I'm going to wash my hands, document, and finish the skill.